Hello and welcome to another episode of MedMadness, where we break down complex medical topics into clear and manageable insights. Today we're diving into selective serotonin reuptake inhibitors, or SSRIs, a cornerstone in the treatment of depressive and anxiety disorders. We'll discuss how these medications work, their common side effects, and how they can be managed effectively. By the end of this episode, you'll have a solid understanding of SSRIs and be better equipped to engage with this important class of medications. Next, let's discuss SSRIs in detail. SSRIs are often the first choice in treating conditions like depression and anxiety disorders due to their effectiveness and safety profile. They work by increasing the level of serotonin, a key neurotransmitter associated with mood regulation, by inhibiting its reuptake into the presynaptic cell. This increased availability of serotonin in the synaptic cleft helps improve mood and reduce anxiety over time. However, SSRIs are not without their challenges. When patients first start taking SSRIs, they may experience a range of early side effects, including nausea, diarrhea, headaches, and notably an increase in anxiety or insomnia. These effects typically emerge within the first few weeks of treatment or after a dose increase, but usually diminish as the body adjusts to the medication. Managing these side effects is crucial, especially for patients with anxiety disorders. It's important to start the medication at a lower dose and gradually increase it. This approach helps to minimize activating effects like jitteriness or increased anxiety. In some cases, temporarily reducing the dose may be necessary to improve tolerability before gradually increasing it again. Now let's move on to another critical aspect of SSRI treatment, antidepressant discontinuation syndrome, or ADS. ADS is especially common with medications that have a shorter half-life, like paroxetine. If the medication is abruptly stopped or rapidly tapered, ADS can lead to symptoms like fatigue, flu-like symptoms, insomnia, and even neurological disturbances. To prevent this, it's vital to taper SSRIs slowly and under medical supervision. Finally, let's consider a real-life example to bring these concepts to life. Imagine a patient named Sarah who was prescribed fluoxetine for her generalized anxiety disorder. In the first 2 weeks, Sarah began experiencing increased anxiety, insomnia, and a feeling of restlessness that made her daily routine challenging. Her doctor recognized these symptoms as common early side effects of SSRIs, particularly in patients with anxiety disorders. Instead of switching medications or discontinuing treatment, the doctor recommended a temporary reduction in the fluoxetine dose. This adjustment helped Sarah tolerate the medication better, and over the next few weeks, her anxiety levels decreased, and she began to experience the full therapeutic benefits of the SSRI. To wrap up, SSRIs are a valuable tool in managing depression and anxiety, but they require careful dosing and monitoring, especially in the early stages of treatment. Understanding the potential side effects and knowing how to manage them can significantly improve patient outcomes. Remember, it's crucial to taper these medications slowly to avoid antidepressant discontinuation syndrome. Before we close, I encourage you to engage with the pre- and post-podcast quizzes available through our platform, as well as the Anki flashcards we've prepared. These tools are designed to reinforce your learning and help you master the material more effectively. Thank you for listening to MedMadness, and until next time, stay curious and keep learning.